today. And welcome to Spectrum Health. I'm Steve Heacock. I'm Senior Vice President of Community Relations here. And we really are honored to have been asked by the Michigan Health and Hospital Association to host this press conference to bring to the attention of the community a great program, the health insurance program for Michigan. It's known as HIP. There are some distinguished guests here today, at least one I want to recognize. A couple. Representative Brandon Dillon is here, represents the 75th District. Brandon, thank you for being here. I see Jordan Bush is here. Jordan is the community liaison for Congressman Amacha's office. Thanks for being here, Jordan. I greatly appreciate it. Matt Van Franken, our Executive Vice President and President of Spectrum Health Hospital Group, is unable to be here today. He does serve on the MHA board and is keenly interested in this topic and very supportive, frankly, of this program. Very much wanted to get word out on the program, so gladly hosted this event. Spectrum Health is dedicated to providing health care for everybody that needs it, frankly. And it and other providers have been urged to help get the word out about this program, really for one reason. HIP is another way to improve access to health care in Michigan. HIP Michigan is offered through a temporary federal high-risk pool that was created by the Patient Protection and Affordable Care Act. It's a federal health reform law that was passed last year, and it's been funded with about $141 million for Michigan and Michigan citizens, and that'll be with federal subsidies as well as subscriber premiums. HIP's a statewide insurance plan, provides health care coverage for those with pre-existing medical conditions. So people that have had trouble getting health care now have access through this program. Its application to employers, for example, might be they might have an employee who's had difficulty over time finding that coverage, getting access to health care. This program's there exactly for that individual. For the first time now in this region, HIP Michigan representatives are here to share details about the program on eligibility rates and more, but frankly, the real news here today is that no applicant will be denied coverage or benefits simply because of a pre-existing condition. On that note, please let me introduce today's speakers. They are Scott Wilkerson, the State Administrator for HIP Michigan. David Seaman is the Executive Vice President of the Michigan Health and Hospital Association. And Andrew Farmer, who is the Associate State Director of AARP Michigan. So I now invite Scott to take the podium.
Thanks for having me here today, and it's great to see you again, Steve. Welcome to Spectrum. I know you'll do a great job. Steve and I have known each other for 10 years or so, so good to see you, and thanks for hosting us in this beautiful facility on a beautiful Monday morning. I want to first start off by talking a little bit about some changes that have recently been announced. 2 weeks ago, we received approval from the U.S. Department of Health and Human Services to offer 2 new products as part of the HIP Michigan program. So now we are glad to announce that we have 3 products in the family, products with a $1,000 deductible, $2,500 deductible, and $3,500 deductible. And with these new products, we can now reduce the premiums to individuals needing coverage under this program by as much as 40%. And we'll talk a little bit more about that in a few minutes. But we're encouraged by the changes that have been made over the last few months to the program and believe that coverage will be expanded even further with these new changes. As many of you know, access to coverage is a significant issue across the country. There's up to 129 million Americans under age 65 that have some type of pre-existing coverage. Examples of the significant pre-existing coverage issues could be heart disease, cancer, diabetes, Alzheimer's, high blood pressure, sickle cell anemia, and arthritis. Older citizens between the ages of 55 and 64 are particularly at risk, with up to 86% of people in that age bracket with some type of pre-existing condition. And as many as 30% of people under the age of 65 who are in perfectly good health today are likely to develop some type of pre-existing condition in the next 5 to 8 years. So lots of folks that don't have insurance. There's up to 25 million people right now who are uninsured under the age of 65 that have some type of pre-existing condition. And these are the exact type of people that this program's intended to target over the next 3 years. So if you know somebody who doesn't have insurance, who has some type of pre-existing medical condition, we'd like to make sure that you make them aware of this program. It does provide peace of mind. It reduces the stress and anxiety of going to a doctor's office or going to a hospital without an insurance card. With this program, you're going to have access across the state of Michigan. People are already booking surgeries and having doctor's visits where they weren't able to have those surgeries or those procedures done without the HIP Michigan program. The program is comprehensive. It covers the full spectrum of health care. It's the same type of insurance that they would get through an employer or through some other type of separate means. It does cover the pre-existing condition, but it also covers all the preventative care and other types of services that they would need. It covers the medical office visits, prescription drug coverage, emergency care, hospital coverage, wellness services, and behavioral health services, so quite comprehensive. Most of the Michigan medical providers are in the network that are available to HIP Michigan members, as well as a very comprehensive set of pharmacies in Michigan and across the country. If they would like to find out if their particular providers in the network, they can go to hipmichigan.com to get more information about the particulars of our network. But we are proud to say that most of the hospitals in the state of Michigan are participating in this program, as well as I think you'll find most of the physicians. Enrollment in April and May have seen significant improvement with the introduction of the new deductible-based products. And right now, really, the biggest issue that we've seen is getting the word out and making sure people are aware of the program and the access that it provides to health care. And that's why we were really appreciative of Spectrum Health making this time available for us today to make sure that the citizens of Grand Rapids and the region that Spectrum serves are aware of the program. And so I want to thank Spectrum Health and Steve Heacock again for graciously hosting this event. And I also want to make sure that I point out a lot of the partners we have in making the state of Michigan aware of this program: the Michigan Health and Hospital Association, members of the Michigan legislature that are here today and that have been at other events across the state, AARP, Michigan Pharmacists Association, Michigan's Office of Financial and Insurance Regulation, the Michigan Association of Health Plans, Michigan Association of Nurse Executives, Michigan Primary Care Association, and of course the Michigan Department of Community Health. So with that, I really appreciate your time, and I'm going to turn it over to David Seaman with the Michigan Hospital Association.
Thank you, Scott, and good morning. The mission of community hospitals is to provide high-quality health care for all, regardless of their ability to pay. Often, patients without health insurance delay needed care. As research has shown, too many people are hospitalized with severe medical conditions that could have been prevented or could have been addressed at an earlier stage. Additionally, the medical bills that result from these encounters are often higher than patients can afford and ultimately result in higher costs to others. That is why the Michigan Health and Hospital Association is working with hospitals throughout the state to encourage patients who are eligible to consider enrollment in HIP Michigan. Ensuring access to care is a priority, perhaps the top priority of all Michigan hospitals. And a number of them have joined us this morning to support programs like HIP Michigan that help to connect people to coverage. Among them, of course, our sponsor today, Spectrum Health. We also have representatives from Allegan General Hospital and the Sparrow Health System in Lansing. The economic pressures faced by our state citizens increase every day. As community stewards and wellness advocates, Michigan hospitals are committed to doing what they can to raise awareness of this opportunity that HIP Michigan provides. the chance to address chronic illness, debilitating disease, the saving of lives, and to make care more affordable. HIP Michigan is not only good for patients and the community, but also for hospitals who are struggling with reimbursement rates that do not begin to cover the cost of providing care. In 2009, Michigan hospitals provided $317 million in charity care and incurred more than $565 million in bad debts, providing needed services to those seeking care. Thus, in that 1 year alone, Michigan hospitals provided nearly $900 million in uncompensated care. Programs like HIP Michigan help to create access points to the healthcare system that link the chronically ill to the necessary primary care they need and they so richly deserve. In addition to this more comprehensive approach to health management, HIP Michigan helps in reimbursing hospitals and physicians for the care provided, thus reducing the mounting bad debt that threatens the existence of hospital services, and in some cases, the hospital itself. Patient enrollment in HIP Michigan will assist Michigan hospitals to continue to provide high-quality, cost-effective care while also reducing the financial burden on their communities. To help raise awareness about the state's high-risk pool, the MHA is helping hospitals get the word out to their employees and to patients throughout Michigan. As part of these efforts, brochures are now available to all Michigan hospitals to distribute to their employees and to their patients. And HIP Michigan posters and flyers have begun to be displayed in hospital emergency rooms and throughout hospital waiting areas. Expanding access to health care through programs like HIP Michigan is a unique opportunity to ensure that those who most need treatment can receive it at the right time and in the right setting. The MHA and Michigan hospitals will continue this important effort, embracing this program and raising awareness of its availability and benefits. And now it is my privilege to invite Andrew Farmer from the AARP to the podium.
Good morning, and honor you all for your courage in showing up in this terrible weather to be here today. I'll be brief. What is AARP doing here? Well, still not very many people understand how AARP began. AARP began because its founder, a retired teacher named Dr. Ethel Percy Andrews, went looking for another retired colleague of hers and couldn't find her, kept searching, found an address, went to the door, knocked, and the person told her her friend, her colleague, doesn't live there. She lives out behind that house. Dr. Andrews went out behind that house and found a chicken coop. And that's where that colleague was living. Because that colleague back in those days, this is over 50 years ago, didn't have a pension, didn't have health care coverage, and had no money left after her own decades of service, raising children and educating them and getting ready for our country's future. That is a synopsis, and that's the nutshell of AARP's DNA for how we show up, caring about and fighting for the expansion of coverage, the access to coverage, to what in the early days we quickly understood to be a condition that millions of people across the country were either living in or at risk of living in. So history then unfolds accordingly. We were there at the establishment of Medicare and Medicaid for those reasons, when markets, for all kinds of reasons, couldn't or wouldn't be able to cover those people. We were there fighting for an alternative, so that those people would have access to coverage and have some type of safety net for their own health care moving forward. And those days, too, was a recognition that that was an investment in preventing more costlier outcomes to society if those kind of initiatives weren't created. Moving forward, that's why, again, we were there when the Medicare Modernization Act was being debated and passed in Congress, and we backed and supported that then because it continued that mission of moving the ball a little bit further downfield at each opportunity we could find to continue extending affordable access to some type of coverage to as many people as possible, especially in the Medicare Part D program that was initiated then. So it goes again. When the Patient Protection and Affordable Care Act was being debated, we were there again fighting for making it sure that it was as friendly and as possible to as many people as possible, affordable access, and whatever means that would assure that that would happen for the maximum number of people possible. So within that, there's this opportunity we're here to talk about today, that while many of the important provisions of that law still do not take effect for a couple years yet, what we have right now is this high-risk insurance pool that is being managed by this organization that still too few people know about. But I want you to know, again, why we're here as AARP. And you see that history that I've laid out to you. It's because we believe, and as I travel the state myself extensively, I continue to be reminded by all the people I meet in communities that a good idea is not a creature of a political party or an ideology. The people living in a real world are struggling to survive. And why we don't care about what party backs what. Because what we care about are issues and what solves problems. And you can see from our history, we've backed a good idea, whether it was a Republican administration in Congress getting it passed, or it was a Democrat Congress or president getting it passed. It's the idea. And that's what real people that I meet everywhere understand and work their lives in. And why we need your help getting this word out about this good idea. Now, what this means in the short term is that while we're waiting for these new private health exchange markets to be created in a couple more years, this temporary insurance is going to make it possible for at least a few more people, and frankly, there's at least a couple thousand who still could be benefiting from this program, to get coverage while they're waiting for these new markets to be created, which will forbid people from being discriminated against anymore on those markets because they had a pre-existing condition. What this program today we're talking about means is that a woman in Grand Rapids who's on Social Security disability insurance, who is getting enough of the Social Security disability insurance payment to put her above the Medicaid eligibility limit, means that she can't access any sort of private coverage because she has some pretty obvious, what anyone would call pre-existing conditions. Though I've heard of a pre-existing condition out there being as simple as psoriasis, causing a denial. Right now, that woman in Grand Rapids can't access any private coverage except for this program. Now, the other problem is that a person on Social Security disability insurance can't qualify for Medicare for at least 2 years while they struggle to keep their Social Security disability insurance coverage. I know about this personally because I worked on Social Security disability cases when I worked for the U.S. Senate for a couple of years. I've seen people lose their homes waiting to qualify for Social Security disability itself, let alone waiting to those 24 months to get that Medicare coverage. In other cases, losing their lives. But in most cases, because they couldn't get Medicare coverage, and this law doesn't change that either, they have their own health deteriorations continue, they become more expensive to care for, and much more difficult to recover or restore to a better level of care because none of that gets changed. This program is a chance to rescue and protect at least a few more people, and again, there's at least a couple thousand still don't know about this who could be benefiting. So I'll shut up from that point and move on and get Mr. Heacock back up here. But the bottom line is that we're here because this is part of our historic over 50-year, over half a century mission about extending affordable access to anyone. We don't care where the idea comes from. It's the good idea that matters and what helps people.
Well, again, thank you all for being here this morning to hear about this important topic. Spectrum Health's happy to spread the word about this valuable program, and our speakers will be available to reporters if you want to talk to them after the press conference. So thank you all very much.